So the first story that got me that award, the first one, was a story about a gentleman with a rare disease called Olier's disease. He was still in his early 20s, but he had undergone about 16 surgeries and more, counting, because of the rare disease. So,
cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions Podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll. Welcome to another episode of the African NCD Champions Podcast, where we talk about non-communicable diseases in all its aspects. We bring in guests and individuals who have lived experience, who have worked in the space, who support work in the space to help us understand these conditions in much bigger detail. And today, we'll be talking to a journalist and a digital health advocate, if I could add that. And she'll be talking to us a bit about her journey, her experiences, and what she's been doing in the digital health advocacy space. And without further ado, give us an introduction to yourself, what you've been doing, and how you ended up on this podcast today.
So my name is Mercy Chelangat. I am many things. I am a mom, I am a daughter, I am a journalist, an aspiring author, and I think most importantly for this, then we'll stick with me being a journalist. How did I find myself in journalism? Long journey. But I remember when I was little, I was fascinated with watching presenters on TV and reading, reading newspapers. My mom was a literature teacher, English and literature teacher. So I was very passionate about books and reading. So if it's a book, whatever magazine or newspaper I can get, I just wanted to read it. Whatever was happening on radio, I wanted to listen to it. Whatever was happening on TV, I wanted to see it. Apparently I manifested being a newspaper writer when I think I was around 10, and I told my aunt, one day I'm going to write for the newspaper. So fast forward, I do my KCPE, and my mom is telling me, you either become a teacher or a nurse, and I'm telling her,
that's not happening.
That is not happening. So eventually, she agrees. I do journalism. I graduate from Masai University. I work on radio here and there, and then in 2019, I joined the Nation Media Group as a reporter. So now that's what I have been doing since 2019. I have been a newspaper desk reporter. So I did general news from that 2019 to last year is when I was moved to the health desk. So while at the general desk, I will do health stories
here and there.
Here and there. Got an award for one, and I think my editor just figured, this young girl would do better at the health desk. So I was moved to the health desk, and it's been bliss. I love it there.
I see.
Yeah.
So this award, let's talk about it. What was the story that led to the award? How did we end up there?
My first ever, I was actually second runners up. This was in 2024. So 2023, 2022, I was second runners up for health reporting print category for the awards that are held by the Media Council of Kenya. So the first story that got me that award, the first one, was a story about a gentleman with a rare disease called Olier's disease. He was still in his early 20s, but he had undergone about 16 surgeries and more, counting, because of the rare disease. So this disease manifests in the bones. So you will get deformed bones and so it manifests whether it's the fingers or the neck. You would find like
deformities.
One shoulder is higher than the other, and then you have like bow legs, and it's just crazy. So you go through very many surgeries, and it's complicated. So me featuring that story is what got me that first award. The second, do I remember the second story? I do not remember. The other award from the Sexual Reproductive Health Rights Alliance was a story on a woman who, I think she's around 55 now, from Bungoma. And you know Bungoma, the way they value children. So this woman had undergone bilateral tubal ligation after having 5 children, and coming from a community where they value giving birth to many children. She stood out as an advocate for family planning services in her community. So the award I got in 2024, in which I was a winner, was on the story we did about NHIF and the fraud. You remember that story?
That was a big story.
Yes, how rogue hospitals defrauded NHIF. That is the story that won me an award this year.
So we should update your introduction to multi-award winning
journalists. What do we say?
We don't say.
We don't say. We do not say it.
I see. So, having worked on all of these different stories, what are some of the challenges you faced in the development of these stories? Because some of them, like the NHIF one, I know is very highly contested and was a contentious story. What are the challenges you faced as you written some of these health stories?
For most of the stories, especially the investigative ones, the challenge usually is, one, there is the aspect of fear from sources. So you know clearly that I'm investigating issue A or B. You know, when I say sources, I mean the people that we talk to, our interviewees. So you would find someone who has the best or the most legit information about an issue. But if it is an issue that is sensitive or involves a high-ranking official in the society, they tend to back off out of fear. So most of the time, when we suffer from this, is you find a source who is willing to speak, and then when you have organized for the interview and you say we are meeting at 10 a.m, they don't show up, and they switch off their phones. So most of the time we often just find ourselves going back to the drawing board, which makes the entire process longer and unnecessary. Which other challenge? The other challenge usually also is trying to find the people to hold to account, or facing threats from the very people that you're trying to hold to account. There is a story I did. It wasn't a health story though. There's a story I did on let me not mention names. So it was a developer. This wasn't a health story. It was a developer who would show up. You see the way you contribute your savings, and then unaenda unajengewa nyumba, you know. So this guy had accumulated a lot of money from very many people, and he was building some houses in Kiambu. Was it Kiambu or was it Thika?
Then I know the story. Yes. That one.
So he's a developer. So he shows up. He builds the houses. He leaves them like maybe halfway done. He disappears. He comes back up maybe a year or two later as a different developer. He does the same thing, doesn't finish the project, disappears, comes back as a different developer. So we had gotten people who had been involved with him at least for over 2 projects. And when we eventually found him, and we were giving him the right to respond, and telling him, why have you been doing this? Because this is unfair. People have given all their retirement savings for
the houses.
And he says, oh, okay, so let's do an interview, let's meet here and there. So we planned the interview, and he says, okay, so let's meet on this day. On that day, he doesn't show up, or he does not pick his calls, or just he doesn't show up. So eventually we decide, because we know the location of one of the projects, we decide, let's just go there and take photos, basically to confirm that the building is there.
And it's halfway
done. So that
done.
you're not writing rumors, and it's halfway done, just to assess the situation. We get there, and we are in our company car, myself, the driver, and the photographer. So the place where this building is located has only one entrance. Later, there is no other exit.
So you have to go through that road. Yes,
you have to go. So it's an entrance, and it's an entrance into a field, maybe about an acre. And there are raw materials for building. So there are kuna zile blocks, what. And immediately when we just get in with our car, there are people who start picking to small weapons and start walking towards the entrance, which is also the exit. So we realize immediately that this is abnormal.
Something is being organized here.
Up, yes. So you see someone with a hammer start walking. There's another one with a shovel. There's another one with a djembe. There's another one with a machete. So we literally just tell our photographer, you're going to have to take the photos while the car is in motion. And we only get in and do a U-turn.
And out.
It was less than a minute. And our driver tells us that I think he had been in another situation before. And what was highly likely to happen is they were going to seal that entrance. Which was also the exit. And then they'd probably, I do not know, probably drag us to the river. Because there was a river Ukuchini. So I think that was, the most dangerous situation I have been in. Apart from covering mandamanos with Raila and inhaling tear gas and missing bullets, I think
on the field.
That was one scary situation to be in.
I see. When you move to this health space, which looks to be your favorite space at the moment, what are some of the interesting stories that you've done there that connect to your work now as also a digital health advocate?
I have done a couple. I have done many. So let me just speak about one that was key for me, and I also believe key for the country. It was a story on how toxins end up on your plate. So you have your ugali, you have your mboga, and your meat on the side. But you do not know where that meat came from. You do not know the pesticides that were used to spray the maize that is now your ugali. So the story basically started from a post I came across on Twitter by the Pest Control Products Board. So the post was basically about how they had arrested a couple of hawkers in Nairobi town and all over the country for selling smuggled pesticides. They were selling pesticides that have not been authorized for sale in the country and were not being produced in the country. So we do a follow-up, we do an interview with the CEO of the Pest Controls Products Board, and he tells us that most of the pesticides that are coming into the country, number one, as I said, they're not produced in the country. We do not know who is producing them because of the labeling of the product. Ideally, if you're producing something, you should say produced by Mercy and Co.
Made in Kenya.
This is where we are located. These are the ingredients we used. But because it is illegal, because it is smuggled, then you do not have those details. And the fact that they were being smuggled from the border into the country. And also, so we also came to realize that most farmers were using these products in their activities. So if they want to get rid of pesticides, because each product has a use. So there's the aerosols for cockroaches and things like that, and then there's the pesticide that you
for
use
the soil
to control a certain pest,
a specific
pest. And then there's this other chemical for this other pest. So if you're planting, say, maize or rice, or was it tomatoes or was it potatoes, you're going to be using different chemicals.
Types of, on one product.
Yes. So the problem is, the farmers were using these products. They were buying them from hawkers and from agrovets, and using these products just recklessly. Because number one, the instructions on the container, either the container does not have the instructions, or the farmer just uses the instructions that he got from another product, which is not this one.
Yeah, so different products, same instruction, you apply across.
Yes, you apply across. And so the challenge here is that you are, it's somewhat wrong use of the product
that you have.
Yes,
because that's not its instruction.
Yes. So assuming you were supposed to use say 1 liter of product with 10 gallons of water, and you're using one product with 5 gallons, so you imagine the danger that is inside there. You do not know the ingredients of this product. And so if you're using wrong measurements, you can imagine the effect when you finally come to consume
and into your plate.
So there is also something called it's called the maximum residue limit, where a crop, once you harvest your maize from the farm, it is subjected to testing, and there is a limit
that it should reach.
The pesticide residue, yes, there is a limit that you're not supposed to go over. But there are crops that were coming in from farmers that were going over that limit. You understand?
So that goes to the people.
That goes to
straight.
You. It comes to you. And the problem is, you cannot really account for what the farmer has used, because again, they do not keep the containers because they know it is wrong.
Yeah, and you also don't know which farmer it came from.
So you cannot even trace it back. So you can ask the farmer, so what products did you use? They will tell you, hiyo mimi nilinunua tu kwa agrovet, nikatumia na nikatupa kwa choo.
I don't know.
I do not remember. So that was that was the first point on the pesticides. The second point was on antibiotic residue and its relation to antimicrobial resistance. So you find livestock farmers now doing almost the same thing. They go to the agrovet, they ask for a specific antibiotic because their cow is sick, and the last time they used a specific product and it worked. So they have gone back for the same product without getting a vet to diagnose what is the problem with the livestock. So they will take that antibiotic. Again, they will not follow the rules of engagement that tells you need to
do this. This is the ratio.
This is the ratio. Yes. And then you end up with antibiotic residue in your milk.
True, because now the cow is antibiotic resistant.
Exactly, yes. And then the cow develops antibiotic resistance. And then the other challenge is that we do not have data that shows how many people have been affected or have developed antimicrobial resistance as a result of taking foods from animals that had this resistance. So that is a very huge gap.
So that's a second way this gets all the way to
Yes.
the food we eat.
Yes. And then there's the whole other aspect of fruits
Yeah,
and
vegetables
chemicals that
and
are
being
injected
sprayed
inside
and
there.
injected.
It's crazy.
I
So I
see.
think that was the most key story that I've done recently that impacts on public health. Yeah.
I see. What did you say to other people out here who want to join, or in future who want to also be called multi-award winning journalists working in the health space and producing all of this important work that is very useful to the public, because we know that awareness is one of the biggest barriers to making decisions. What did you tell people who are coming up or who want to be in the space are some of the insider tips of how to get to where you are today?
Number one, you have to be really passionate about what you are doing. You have to be the person who does not seek for monetary fulfillment. Because for us as journalists, our fulfillment is in Steve calling me and saying, "Oh, Mercy, you remember the story that we did together? That really touched me. This 1, 2, 3 has changed in my life." That is the best. That is the best fulfillment.
And have you gotten people
We
call
have.
you and report that?
We have. You do a story and a person calls you and tells you, "Oh, I was drowning, you saved me." Because just putting information outside there. Even the Bible says, "My people are destroyed because of lack of knowledge."
They perish.
They perish because of lack of knowledge. So when you empower someone with knowledge, I think that is the most important thing that you can do. Because then they are able to make informed decisions. Because after I have told you that your maize has pesticides,
Now you have
it
to.
is now
you
up
have
to
to
you
check.
whether you want to eat that maize or you
not.
want to check, or you want to change the way you eat. Yeah.
I see. So passion is
Passion, you have to be good at what
so
you do.
excellence.
Yes. So it's passion, it's excellence, it's your drive for justice. Because as journalists, we are also there to be a voice for people who do not have a voice. You are there to be their mouthpiece. So you have to also be as passionate as they would be
On the
if
topics.
if you were in their shoes. Yeah.
Because essentially the role of journalism is also to represent those who can't speak for themselves.
Exactly. Yes. Yes.
I see. So, closing remarks. What would be the key message that you would want people who are listening, who are looking at you, and you're like, "Hey, me, I also want that. That story. I want it to be mine in a few years' time." What would be your key messages to them, and what would you want general public who are listening to this to remember when they listen to this conversation again?
The power of knowledge. I think we need to create a culture of seeking knowledge, and not just seeking knowledge anywhere, seeking legit and credible knowledge from credible sources. Because there is also a lot of misinformation that has been coming up of late. So I feel like when we are empowered with knowledge, we can do a lot. We can better ourselves, we can better our lives much more than if we didn't have it.
Right. So I think this brings us to a nice close. And when you're just talking about knowledge, the phrase that really came up for me is knowledge really is power.
Knowledge is power.
Yeah, if people know,
power.
they take action, and
will.
they are more informed on the actions that they take.
Yeah.
Yeah, so with that, thank you very much for coming. This was very interesting. We should
Thank
do this
you.
again.
We will. I promise.
We should do this again back in our studios in Nairobi when we get there again. But again, thank you very much for coming and for
Thank you for
agreeing to
having
be hosted in the middle of the night
Thank you.
to record an episode. Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.